know this number is scary for the most of the people. Struggling single mom. Young age, she got breast cancer. Just imagine the look, the hair going.
Hi, I'm Dr. Nusrat Jabir. I'm specialist in general and laparoscopic surgery. I do perform the breast surgeries also, and I work in AL-HILAL group of hospitals, Bahrain.
Hi, I'm Dr. Anita Kumari Bhaskaran. I'm consultant radiologist working in Al-Hilal Hospital, Muharraq.
I am Dr. Bibi Nazaria, specialist radiologist in Adliya branch of Al-Hilal Healthcare Group in Bahrain.
Hello, Assalamu alaikum. I'm Dr. Maimoona Liaquat. I'm consultant OB-GYN laparoscopic surgeon. I'm presently working in Al-Hilal Muharraq and dealing with all the other branches of Al-Hilal. Today we'll be here for breast cancer awareness. Let's go ahead. All right, so we're going to be discussing about the breast cancer awareness as we all know. So let's start. Who would like to go ahead with the first question?
I think I will.
All right.
We have often heard the statistic that 1 in 8 women will get diagnosed with breast cancer during their lifetime. And with the lifestyle that we are leading today, do you think that this risk will increase further? What is your take?
I know this number is scary for the most of the people, but we know that beside the positive family history, there is some risk factor that can be modified, including alcohol, smoking, sedentary life like lack of exercise, lack physical activity, poor diet, other including like sleep disturbance, also anxious and anxiety, including stress. This all can affect. So the best and the golden point here that we can change and modify this factor. So the breast cancer risk will be
Very yes. There's one thing I want to add and see. People have to understand when we're talking about 1 in 8, it doesn't mean their risk is 1 in 8%. It means 1 in 8 is a life risk.
Yeah.
So this is a very misconception. People take it very serious that my chances to die is like 1 in 8%.
Yeah.
Doesn't work like that. It's your lifetime. In the whole life, the risk is 1 in 8.
I have one question for you.
Yes.
Across your career, have you come across patient or a case of a breast cancer that really stay with you, and you, according to that, you change your approach of a patient or the way according to that?
That's a very, very touching question, because the way you asked that, has it changed my approach? I can remember a case which is very, very close to me, very special. A woman who was whose husband passed away, struggling single mom with 2 kids and family, with her. At young age, she got breast cancer. She was struggling with her treatment. She didn't want to put the burden on the family. She didn't want to tell her kids because the fear of cancer and the fear of death, these two go together for our normal people. So what happened was she didn't share her things with her kids, with her family, and she started her treatment. Now you can imagine being single mom, the financial burden, the no support, the fear of your kids, like if something happens to you, what's going to happen? She was struggling like anything. And in our culture, we don't have a lot of social support openly. You have to go and look for them. So she totally came and she broke down once. The fear of self-image, because when she went through chemotherapy, just imagine the look, the hair going, people staring at her, all that was really, really getting deep in her. And I remember when she came to me, she was like, she was broken. She just cried like anything, and I didn't know what to do, how to help her. So I actually told her that I will help her break this bad news to her family, so that because she has to have someone, she needs someone to share, someone to take care. So the cancer is all about your support around. It's not just you. I mean, if you are going to put yourself that I have a cancer, I will deal with it myself, trust me. Totally that.